Good morning, Ma'am Miss. My name is Janet Baruro Mojado. Then I am a student nurse for today. So today I'll be performing the abdominal assessment. So the purpose for this is to get more information that could indicate what is causing the patient's symptoms. So perform 4 techniques in abdominal. So examination such as inspection, palpation, percussion, as well as auscultation. So for the equipment required, so examination table, patient hospital gown, record form, disposable gloves, 1 pair, then stethoscope. Then for the preparatory phase, so explains the abdomen of the patient to be visible fully to assess the abdomen properly. So the client should be emptied the bladder or wala suot ang iyang bladder to prevent the discomfort. Then keep the room warm. So the stethoscope and in the end phase, then your hands must be warm. So to avoid chilling and tensing of the muscles, then position the client supine with the head on the pillow, then the knees bent or on the pillow and arms and the sides of the across the chest. So to enhance the abdominal and relaxation. So inquire about any painful areas and examination such and the area in the last, then to avoid any muscle guarding. So for the performance phase, so first, so I would like to wash my hands to one, two, three, go. So hi ma'am. So good morning ma'am. How's your day ma'am?
Okay lang po.
So, your name, ma'am, is
Claire Idupitas.
age,
I'm 19 years old.
then your address, ma'am.
Linas.
So, okay, ma'am. So, today, ma'am, I'll be assessing your abdomen, ma'am. So, it's okay to you, ma'am, that na akong iwalasin mo sa ina, ma'am, kay aros maklar na itong clearly ang imong abdomen, ma'am, as there is any abnormalities, ma'am. So, nakapay questions, ma'am. So, naka-history about HEPA, ma'am? Or mga sakit-sakit sa tiyan, or any cancer or ano, ma'am? So, okay, ma'am. Thank you, ma'am. So, before I start, I would like to wear my gloves. So sorry for the interruption during wearing my gloves. So inspect the abdomen, so the contour. So stand the client's right hand side and look down the abdomen. So assess for the position of the abdomen or any abnormalities it present. So ma'am, pwede na ako kuwalis sa nina, ma'am, para makita na ako ang imong abdomen, ma'am, or any abnormalities, ma'am. Okay, ma'am. Ma'am. So, okay ma'am. So, as I observe na my patient abdomen is in the midline and that is normally ranged from the flat to rounded. So, flat siya din. Rounded ka ma'am. So, for the symmetry, note any localized bulging, visible mass or symmetric shape while the client takes a deep breath. So, assess the symmetry of the abdomen. So, ma'am, pili na ako kamuhan niyo ni mo ma'am nga ka lang mo. Deep breath ka ma'am. Ginawa, ma'am? So, okay. So, I observe, ma'am, na ang imong abdomen, ma'am, kay symmetry, ma'am, then bilateral siya, ma'am. Bilaterally. So for the skin, so inspect the skin. Notes the striations, scars, lesions, rashes, or dilated veins and turgors. So to detect the abnormalities.
So ma'am, kaya kaya ako mga skin na mabay niya pero this na ba siya yung mga samad-samad.
So, okay naman siya, ma'am. So, as I observe my patient's skin color or turgor, so the skin is smooth and even and there is no presence of scars and lesions.
Po ma'am, so wala ko nakita nga mga dermatitis ng bukol-bukol eh. So normal siya ma'am.
So, for the umbilicus, so observe the contour, location, inflammation, or bulges. So, assess for any discoloration and inflammation.
So,
So, as I observe, the umbilicus is in the midline. So, iyang kuan, umbilicus niya. Then the inverted and there is no sign of discoloration, inflammation, or hernia po. Sa imong kuan, ma'am, sa imong Bisaya, ma'am, mga pusod pa siya natin. Nasa sa center, ma'am, so wala siya any problem kay magpusod kay kuan siya, ma'am, tanang pagalo. Then, so, in today's session, karang magamit ko ang stethoscope. Then, auscultate the bowel sounds and vascular sounds. So, the bowel sounds lessen the abdomen before the performance precaution of palpation. So, place the diaphragm of your stethoscope gently in the abdomen. Then, listen for the sounds and noting the characteristic frequency of the bowel sounds. Then, suspect the absence of bowel sounds. You must listen for 5 minutes by watch before deciding the bowel sounds and completely absent. So, not to alter the frequency of the bowel sounds. So for decision, I'm using my stethoscope. So, ma'am, I'll be auscultating your four quadrant, ma'am, to paminaw na ito ang bowel sounds sa imong panaman. So, as I observed, the bowel sound of the abdomen is normal because it consists of clicks and gurgles that occurring the estimated frequency of 5 to 10 times per minute. So as I auscultate your kwan, ma'am, sa imong 4 quadrant, ma'am, so naku na yung ganyan kami itong motion, kami itong hawang, sila itong nindot. So natural ka na siya na, sa ikan mo mapila itong mamulog-ulog pagdiyan. So, normal dyan na siya, ma'am. So, kaya nga ito pala ka, kaya namin process mo na sa ilalo. So, for the vascular sounds, use the belt portion of the stethoscope. Listen to the abdomen, noting the presence of any vascular sounds or roots. Then, using firmer pressure, check over the aorta, then renal arteries, iliac, and femoral arteries, especially for the person with hypertension. So, no application, page, timing of the vascular sounds. So, So, as I observed, there is no sounds or present na may mga abnormalities na tulog. So, for the precaution, generally the maneuver span the splenic dullness. So, number 1 is to percuss the abdomen lightly in all 4 quadrants. So, to assess the distribution of temperature of the dullness. Then, note any large dull areas of that might be indicate the underlying mass or the enlarged organ. So, one of each, if this the protuberant abdomen, not the abdominal temperature, the change of the dullness of the solid posterior structure. So to assess the amount of distribution, to cast the abdomen and identify the possible masses that are solid or liquid filled. Then also estimate the size of the liver and the spleen. So ma'am, decision ma'am, kanang mag-percuss ko sa imong abdomen ma'am. So okay lang po ma'am. So okay ma'am. So as I observe, the sympathy of my patient is predominant because the gastrointestinal tract and you have also the normal dullness in the liver and the spleen. So as I observed ma'am, during percussion ma'am, so nadyo siya tingog ma'am. So lahat siya diri sa babaw, lahat po siya diri sa sentro, lahat po siya diri sa ubos ma'am. So every kwan ma'am kay lahat man nag-texture atong skin ma'am. So every inside po ma'am kay na siya ilahi na kuan ang tanang bitaw inner parts ma'am. So matod lahat siya tingog. So palpate for the surface and deep area for the perform palpation. So lightly palpate the place of the client, find the position, then keeping your hand and forearm of the horizontal plane. With the first 4 fingers, close the together and flat into the abdomen on the surface. Then ask him to relax in his or her abdomen. So depress the abdominal surface about 1 centimeter. Then make a light, gentle rotary motion and sliding the finger and the skin together. So then lift the fingers and clockwise to the next location around the abdomen. Then palpate in all quadrant to form the overall impression of the skin surface and superficial. So ma'am. So ma'am, mag-percuss na po ko ma'am. So okay lang mo ma'am, idot na ko siya. I mean palpation ma'am, palpation rather. So, okay lang mo ma'am na mag-use ko 3 fingers na ako ma'am, test ako lang siya idot o gamay, slightly lang tayo ma'am. So, okay ma'am. So, as I observed, the abdominal is there no presence of tenderness and mass. So, during my palpation, wala ko yung nakakuan nga any contamination, bukol-bukol sa ilalo ma'am. So, it's normal na kayo ma'am. Kaya normal na imong kuan ma'am, imong abdominal ma'am during my palpation ma'am. So, for the deep palpation, so perform the deep palpation using the same technique that describe the so the earlier push down to 5 to 8 centimeter to 2 to 3 inches. Then moving the clockwise, explore the inter-abdomen. So to overcome the resistance of very large of the obese abdomen, use the binaural technique. So the top of the hand of the pushing, then the bottom hand is relaxed and can be concentrate on the sense of the palpation. So, as I observed, the abdomen will palpate during my palpation is normally. Then, siya, palpitable siya. Then, the second process, then ang imong liver din ma'am. So, normal naman siya ma'am. So, then the edge of the right of the kidney in the segment colon is mild and the tenderness with palpate, which is normal ma'am. Kaya wala ko yung nakita ma'am nga kanabit ko siyang kahit siya ipalpate ma'am. So, normal na kalis na ma'am. So, yun ma'am, normal na siya ma'am. So, kuan ma'am. So,
Can you please kuan ma'am? So, humana ko ma'am. Ako na siya i-move ko ubos ma'am. So, can you please sit ma'am? Pwede na ka mo lingkod ma'am. So, for the others, then after completing the examinations, to explain the abnormal findings and what needs to be done. The examination is normal, hold everything is normal examination. So, ma'am, so, as I observed after the examination, I observed that there is no abnormalities present like fluid excess, so asymmetrical and the tenderness. So, for ma'am, during the assessment na ako ma'am, so nakita na ako ma'am, normal ang imong tiyan ma'am. So, wala ko nakita fluid sila ma'am. Kung na may fluid diri ma'am, parang siya ma'am. Mga fluid di mo na siya i-intake ma'am, pero wala ko nakita na halamitang na any borage ma'am or any dullness ma'am. So, normal na siya ma'am. So then, this is, remove my gloves to wash my hands. So, I wash my hands to avoid the infection during the direct contact examinations with the patient. So, then alcohol swab. So, document findings. So, to be assessed by the attending physician. So, hi ma'am, good morning ma'am again ma'am. So as I observed that your abdomen is during the assessment ma'am is normal siya ma'am. Then I don't see any abnormalities of your abdomen ma'am. So for the final result ma'am, I will send it to your attending physician ma'am. So to know that there is any abnormalities ma'am or siya na mo inspect og ayo ma'am ko or sa akong mga result ipahatag niyo, so niya na to nakita ko sa iyang final findings ma'am. So sa ako ma'am, so wala ko nakita any problem sa mga abdominal area ma'am. So thank you for your cooperation ma'am, then stay safe.